one. Good afternoon, everyone. Let me turn down my volume. Thank you for joining us for this vaccination update with Dr. Cara Christ. A reminder that this is a on-the-record session. You're welcome to record. We're setting up everyone to record. After Dr. Christ's presentation, we'll be glad to take questions from you. We have a hard stop at 2 o'clock today. With that, I'll turn it over to Dr. Christ.
Good afternoon, everybody, and thank you for joining us today. For those of you that don't know me, I'm Dr. Cara Christ. I'm the director for the Arizona Department of Health Services. We hope everyone has had a great week. Today, we want to go through the data, where we are on vaccine distribution, and some exciting announcements that we made this week. But as always, I'll provide a brief presentation and leave time at the end for questions. So our current COVID-19 data, as you can see, after reaching our peak back in January, we have been on a steady downward trend in our cases week over week, and that has been for the last 10 weeks. Our hospitalizations, our emergency rooms, as well as those in the ICU, all are trending down in this same manner, as well as our COVID-like illness. Again, you can see that our epi curve, which shows us the number of cases each day throughout the course of the pandemic, overlaid with our mitigation strategies and important events that we believe impacted or had an impact on the COVID-19 pandemic, are overlaid onto the graph. And you can see that we continue to see a downward trend in our cases. And again, our percent positivity is having that same downward trend over the last 10 weeks. This one is a little bit different than what you see on our website. This is the total number of tests performed in Arizona. The dark bars are those that are unique Arizonans, and then the lighter gray bars are tests that were performed as repeat tests in Arizonans who had already been tested. As you can see, our percent positivity is about 3.2% for this current week, which is really good, and that is in the direction that we like to see. Moving on to vaccine distribution, we have several counties that have moved forward in offering vaccinations to additional groups. The majority of the state is offering to 55 and above, since we moved to our hybrid prioritization, and we've got a lot of questions based on the hybrid prioritization, so I'll go through that in a minute. But you can see that we've also got counties that have moved forward. Gila, Greenlee, and Pinal are all offering to 16 and above. The majority of the counties are still offering 55 and above, but Coconino recently moved to 35 and above. So our counties continue to move through the prioritization. I'll explain what triggers the moves through and where we are. So if you look at the percent of individuals aged 55 to 64 that have been vaccinated in Arizona, at statewide, we are at approximately 33% of those individuals being vaccinated. You can see that some counties, although, have higher rates of those populations vaccinated, including Coconino, Greenlee, and Maricopa. So we continue to monitor this. This was also an exciting update that we added to our dashboard that I'll talk a little bit later, so that individuals in Arizona can track where each of the priority groups are. What we recommend is that as a group, that we are watching, it reaches about 50 to 60% of those vaccinated, or the demand slows, jurisdictions may move to the next group. Again, we get a lot of questions about the hybrid prioritization model that Arizona has adopted. This was a direct response to data that showed that our higher ages are at an increased risk for severe outcomes from COVID-19, including hospitalization and death. But we also wanted to make sure in Arizona that we weren't going to just strictly an age-based prioritization, but the counties have the ability to vaccinate frontline essential workers as defined by ACIP. The counties may also add additional industries as they feel their communities would benefit from that. They may also subprioritize if they don't feel they have enough vaccine for all of the essential worker categories to be opened up. They may choose to work with specific industries and move forward. One of the strategies that they can use is employer-based vaccination strategies so that they know they are getting those employees that are frontline essential workers vaccinated. We've shown data the past couple of weeks that Arizonans in our 55 and above age group comprise a majority of those with high-risk conditions and a risk of severe COVID-19 outcomes. We have updated our anticipated dates for when we expect to transition based on our available doses. Back on March 1st, we transitioned to our 55 and above. We anticipate transitioning to 45 and above from a state perspective on or before April 1st, and then transitioning to our 35 and above sometime in mid-April with a transition to all Arizonans who are eligible, which would be 16 and above, depending on the vaccine, starting May 1st, if not sooner. So we continue to monitor what percent of each of those age groups the state has currently vaccinated. But you can see that second column from the right shows the estimated coverage of all Arizonans that have a high-risk condition, putting them at risk for severe COVID-19 outcomes that would be included with when we include that age group. So again, when we increase to our 55 and above age group, we anticipate that we were getting about 56 to 66% of all Arizonans with a high-risk medical condition. When we move down to 44 and above, that increases to almost 70 to 80% of all Arizonans included. And again, when we move down to 35 and above, we anticipate that we're about 80 to 90% of all Arizonans with those high-risk conditions covered. We believe that this prioritization gets us through those with chronic medical conditions much quicker than our previous prioritization allowed them. They would have still had to wait until after we had vaccinated our very long list of essential employees. So again, counties are able to move earlier than the state if they reach that 50 to 60% of their age category vaccinated or demand slows down. The state will move if we reach a statewide total of 50 to 60% of that current age group vaccinated. Again, this is going to apply to our state pods, our pharmacies, our federally qualified health centers. The other thing that could cause us to move into the next age group earlier is if we see a decrease in demand. The way that we would identify a decrease in demand is if we have appointments that we have opened up that aren't booked, if we've got a lot of available appointments or a lot of no-shows. We are currently evaluating that. As I'm sure you're aware, we opened up a large number of appointments over the next week, today at 11, and we will be monitoring to see how the demand was for those appointments this week. The other part of our hybrid prioritization is our frontline essential workers. So again, prioritizing those frontline workers as defined by the Advisory Council on Immunization Practices that don't meet the age eligibility. Once they meet the age eligibility, they're eligible at all places. But those frontline workers, we want to make sure that because they have to come into constant contact with the public or their coworkers and their jobs cannot be done from a remote location and their job is essential to keeping our communities running. We are allowing our county health departments to work directly with employers or to offer vaccination opportunities for those frontline essential workers. Again, they could subprioritize based on using the occupational category, if they wanted to prioritize it to age groups or those with medical conditions based on the limited vaccine that they have. That is possible. It is also possible that our county health departments can add additional frontline workers that they feel is required for their community. For instance, utility companies, certain manufacturing, those types of things are allowed at the county level. There are strategies that we've discussed so that they can target essential workers. That includes prioritization, utilizing the brand new Johnson & Johnson or Janssen vaccine for our younger, healthier essential workers, offering employer-based pods or offering private groups that would be available for scheduling those appointments. And so again, there's frontline essential workers and then there's essential workers. And both of these are defined by ACIP. Those frontline essential workers are a very small subset of the essential workers that ACIP feels are at highest risk for work-related exposure. And that's because their work-related duties have to be performed on site. It involves being within 6 feet to public or other coworkers. And so sticking with that list, we've already covered a couple of those, our first responders, our correctional officers, our education and childcare professionals. It would open it up to food and agricultural employees, the United States Postal Service, industries involved in manufacturing, grocery store, and public transit. And that public transit is really an actual limited subset of what you would imagine all public transit is. It includes buses, light rails, ride share, those things that allow individuals to get back and forth to their essential jobs. As we move in and get additional vaccine, other essential workers may open up. That could include transportation and logistics, water and wastewater, food service, shelter and housing, finance, our media partners, some of the public safety and energy and legal services. When you go onto the CDC website, they break those out by being 1C essential workers or 1B essential workers. Based on our previous prioritization, a lot of these were included in our 1B group as essential workers. Here's the graphic that's available on our website. This is our hybrid vaccine prioritization. So the two groups that are eligible are those based on age and when we anticipate seeing those move, and then the frontline essential workers. And our phase 1A and our prioritized 1B groups always remain prioritized. So even if an individual who was in one of those groups opted not to get vaccinated at first, they are still always eligible to get an appointment or receive the vaccine at any time moving forward. They do not become unprioritized. This week, we were excited. We saw a increase in the number of vaccines, and I am so sorry. We will have to send those numbers out. I didn't realize that would get cut off on the screen. This week, we did receive a little bit of the Janssen or Johnson & Johnson vaccine, almost 16,000 doses. And we did see another small increase in the amount of Pfizer and Moderna that we were getting. These numbers include both first and second doses, and the state manages the Pfizer vaccine and works with all of our pods to ensure that appointments are covered as well as that they have the doses that they need to make sure that they've got the throughput. The Moderna and the Janssen is allocated out to our 15 county and 4 tribal local allocators, and they work with their providers to get those vaccines distributed statewide. So as of today, over 2.7 million doses of vaccine have been administered in Arizona. That includes 1.7 million Arizonans who have received at least one dose, and over 1 million Arizonans who are fully vaccinated. You can see that we continue to increase our vaccination capacity here in Arizona. The graph on this slide shows the number of doses administered per day. It is filterable by county, so if you're interested in seeing what specific counties look like, all of this filters when you click on the county on the left, or you can also click on the button down at the gray button on the bottom left that says state pods, and that will give you the information of all of the state pods collectively to see the vaccination and how that is progressing forward. This week, over 1,000 provider sites have received vaccine and are eligible to administer that vaccine. We've had over 1,500 long-term care facilities continue to participate in the CDC Long-Term Care Pharmacy Partnership Program. This has been a really great program for those. Arizona was the state with the highest number of facilities enrolled, and that's because we opened up our eligibility not only to our skilled nursing facilities and assisted living facilities, but opened it up to our assisted living homes, our behavioral health residential homes, as well as our group homes for the developmentally disabled in our facilities for individuals living with intellectual disabilities. We've had over 460 pharmacies receive a limited vaccine supply through the CDC Federal Retail Pharmacy Partnership Program. We have over 800 pharmacies throughout the state that are onboarded and eligible to receive vaccine. So as that program continues to get additional federal allocations, that program will continue to expand and add additional retailers over time. So people are always asking us, how do I make an appointment at a state pod? There are multiple ways that you can make an appointment. You can always go to our patient portal at podvaccine.azdhs.gov. We do have a guide and a little video that shows you how to use that pod and provide step-by-step instructions, but we continue to make updates to make it more user-friendly and easier to navigate. And we are listening to feedback, so if there's feedback, please let us know. You can also find more information on all of the providers and their registration information if you go to our website at azhealth.gov/findvaccine. That has that interactive map where you can choose a location. If you click on a specific location or pin on that map, the registration information, the hours of operation will come up so that you can directly schedule at that site. If you are not comfortable using the internet or don't have access or just need additional help, you can call our call center at 844-542-8201 to be connected with a live person who can assist with scheduling. One of the things that we would recommend if you are actively looking for a vaccine, appointments that have been canceled or people have rescheduled, we open up appointments to our call center every morning at 8, so that is another option for potentially identifying vaccine at one of our state sites. One of the things that we announced this week is that we will be opening up new appointments for vaccination at our state sites every Friday. That will include appointments for the upcoming week, and we will start to get into that regular cadence of where we announce the appointment availability on Wednesdays. It will open up at 11 a.m. on Friday, and then that will fill in the appointments for the upcoming week. What we've identified is as people were booking farther and farther out for those appointments, we were getting increased cancellations because there is increased vaccine availability throughout the state, and people have been able to get an appointment earlier at a pharmacy or at some of the community sites offered by our county health departments. And so now we think with having weekly appointments that are scheduled for the next week, hopefully that will decrease the number of cancellations that we are having at the state pods. If you'd like to make an appointment at a pharmacy at your house, again, there's a couple of ways that you can do this. You can go to azdhs/findvaccine and identify the location of that pharmacy, and that should take you to their website for you to register. You cannot register for a pharmacy appointment through our podvaccine.azdhs.gov site, but you can go directly to each of the pharmacies that are currently participating in both the federal or the state pharmacy allocation programs. And so you can go to Walgreens, CVS, Fry's, Safeway, Albertsons, and Walmart. All of them have sites where you can register online in select stores. Again, not all of the stores are going to have vaccine at this time because we are still receiving limited amounts. It is increasing each week, so we would continue to recommend that you, if you are actively looking for vaccine, to go to our pharmacy websites as well. So some exciting announcements this week. One of the exciting announcements was new dashboard updates. We updated our summary page, the way we're displaying our race and ethnicity data. We added those filters for vaccination by zip code, and we also added a brand new page and button on our data dashboard for vaccine prioritization. I'll walk you through each of those, but our summary page has been updated to include elements that we think have the biggest impact on the course of this pandemic. So you'll see that the cases and the death data remains unchanged from the previous summary page. But now what we are doing along the bottom is reporting the total number of tests administered, and we're using the percent positivity from the total number of tests. We've removed the serology data as well as the total number of labs, which included serology and diagnostic, from that right-hand column. And instead replaced that right-hand column with vaccination data. The elements, though, that were removed from the summary data, including the serology results and the laboratory data from unique persons, can still be found on our laboratory tab of our dashboard. So the data is still there, it's just not being displayed on our summary website page. And again, this page is still filterable by the county, so if you wanted to see county-specific information, you can go directly to that. Now, we've shown you today's vaccination administration data dashboard, but if you look in the bottom middle of that dashboard, what you will see is that we have changed the way that we're displaying our race and ethnicity data. And so it's been updated to provide more specific and complete information. This new updated table breaks out other from unknown because other is very different than unknown. And it's going to add specific ethnicities. So now we've got specific Hispanic or non-Hispanic categories to provide additional clarification on our vaccinated individuals. So in addition to seeing the number of vaccinations administered to the residents of each zip code, we've added new layers to our zip code map that will provide more information and to make the data more useful, because the numbers don't really help you if you don't know the denominators or if you don't have additional information. And so if you look in the upper right-hand corner of the map, you'll see two little icons. One looks like a little magnifying glass and the other looks like a stack of squares. If you click on that stack of squares, the filters will come up, and you can either choose you can either choose to still see the numbers. You can add the percent vaccinated over the age of 65, and then you can also add the percent of individuals vaccinated over the age of 18. This map you can see is showing you the percent that are vaccinated over the age of 65. Darker means that there are more people, a higher percentage of individuals that have been vaccinated over the age of 65. Lighter means less percent. And so you can click on that, but it is that little square, that little icon that looks like a stack of squares up in that right-hand corner. And we know that our risk of hospitalization and death significantly increases with age. So we adopted our hybrid prioritization model that's going to focus on those at highest risk, including those that are of increased age. So we added a vaccine prioritization page to our data dashboard. It's the last button in the bottom row of all the buttons that you can select from. And so this is going to show the percent of each population whether you're looking at the top grant or the top for 1A and the prioritized 1B, and then each of the age categories that have received at least one dose of vaccine. So the current recommendation is to proceed to the next age group when a county or the state hits 55 to 60% of the age group vaccinated. This is also filterable by county. So if you wanted to see what one of the other counties, how close they are to advancing into the next age category, you can click on that county and it will show you. So for our state vaccination sites, over 700,000 doses of vaccine have been administered across all of our state pod sites. We've had over 500,000 doses of vaccine administered at State Farm Stadium alone since it opened on January 12th. One of the things that all of us from Arizona know is that our weather here is going to start transitioning to be where it's less pleasant outside. So we are working with our partners on finalizing plans for transitioning our state sites to indoor locations. And we are planning on continuing to increase the vaccination capacity. So I'm gonna walk you through some of the transition of those vaccination sites and what they mean. So State Farm, our very first vaccination site, is, I'm sure for those who have been out there know that it's in the middle of a parking lot, which is going to get very, very hot. One of the concerns is that our technology, as it gets over 90 and 100 degrees, will not work as well or at all. And we want to make sure that we are keeping our patients and our volunteers and staff out there safe. So what we will be doing is transitioning to overnight operations only as of April 4th at State Farm. The site is going to pause operations at midnight on April 3rd, and we will presume providing vaccinations at 5 p.m. on April 4th. Following that, we will have operational hours from 5 p.m. until 9 a.m. the following day. We will set up between 4 and 5, and we will break it down from 9 to 10. We are working with partners. We have a couple of really great indoor options that we are evaluating to move to in April. But I will say our goal is to stay on site working with our current partners, including the Cardinals, until we have administered 1 million vaccinations. That obviously will be dependent on the weather and how long our technology can stay operational and we can keep our patients safe. But we would really like to hit that 1 million goal mark at State Farm. Those overnight appointments will continue as we look to transition the indoor into an indoor option. State Farm will maintain its capacity even as we transition into an overnight of over 500 shots an hour. But we will be looking for something that has at least the capacity of a State Farm as we move into the indoor sites. And the couple of sites that we've identified do have what looks like would be a significant capacity. For our Phoenix Municipal Stadium, it is going to continue to operate from 7 a.m. to 5 p.m. There is a little bit more of a breeze that goes through there if you've been to that site. And there's also more covered areas. So we can continue to operate that site as we are working with Arizona State University to identify a new location that we are going to transition to in April. For our Chandler Gilbert Community College site, this site is scheduled to stop operations at the end of the day on April 3rd. We have a new Southeast Mesa pod that is going to open up on April 5th. This is just about 10 miles away from the Chandler Gilbert Community College site. And those that are going through our Chandler Gilbert site are having their second dose appointments scheduled at this new site. So this is an indoor site that will be able to provide up to 10,000 vaccinations per day. So we're very excited about that. And we've been working with our University of Arizona partners down in Tucson. They still have plans to continue operating as they are now. The really cool thing about the University of Arizona is not only do they have the drive-through site, which is on grass, it's in a relatively shaded area. They've got a lot of overhead structures to keep their people cooler. But they also have a concurrently operating indoor site. And so if we needed to move them indoors because the weather was too hot, that would be something that we would consider. And so the other exciting news that we heard that we provided this week is that we will be opening the Yuma Civic Center vaccination site. So this will be the first location outside of Maricopa and Tucson or Pima counties. And this indoor location is going to transition to a state-supported site operating 7 days a week from 7 a.m. to 5 p.m. on March 29th, and will offer up to 8,000 appointments per week initially, but it does have the capacity for about 28,000 appointments per week, or 4,000 appointments per day. This is a really cool partnership with Yuma County, the city of Yuma, and Yuma Regional Medical Center and the state to provide this brand new location. So we will be opening up with appointments for the week of March 29th. They will be available starting Friday, March 26th on our website, or by calling 844-542-8201. This site has been operating a couple of days each week and has been administering the Moderna vaccine. So one of the things that we want to make sure that we are, we will, as we transition this to a state-operated site, it will be transitioned over to the Pfizer vaccine. However, those that got their first doses of Moderna, we will work with our local county health department in Yuma to ensure that those that got their first dose will still be able to receive their second dose of Moderna at that site. We were very excited when our federal partners at the Centers for Disease Control and Prevention released a new report this week that ranked Arizona among the best states in the nation for getting COVID-19 vaccine to our vulnerable communities. They found, using social vulnerability index, which is something that we look at to determine how resilient a community is, if they were to be faced with a natural disaster such as a flood, wildfires, a disease outbreak such as COVID-19. And it looks at about 15 indicators, which include socioeconomic status, age and disability status, minority status and language, housing type and transportation access. And all of that is used to assess and determine what the social vulnerability of counties in the United States are. This report pointed out that Arizona is one of only 2 states that had greater COVID-19 vaccination coverage in its counties with high social vulnerability in its counties, with low social vulnerability across all of the metrics, including overall. So that was very, very exciting. In most of the other states, the COVID-19 vaccination was lower in those counties with high social vulnerability when it was compared to their counties with low social vulnerability. So that was very exciting. One of the things that potentially played a role was our high intensity targeted communications and the outreach that our county health departments have been doing to some of our most impacted zip codes. We have been working on the pilot in the 85009 zip code to provide intense social media, teletown halls, both in Spanish and English, community messaging, which included yard signs. And we are looking at expanding this to additional communities, including South Phoenix. We have plans to expand to Yuma as well as Mesa and additional communities as we move forward. One of the things, in response to our requests, our multiple requests for additional vaccine in Arizona, our federal partners reached out last week and offered us a federally supported and managed vaccination site in Arizona, which allegedly would bring in additional vaccine above the state's current allocation. However, Arizona would need to provide a significant proportion of the staffing and resources, and we wouldn't have had the oversight of this site and could not require the same efficiency and customer service that's provided at our current operating sites and that Arizonans expect now based on their experience with our mass vaccination sites. We appreciate the opportunity to partner with FEMA on the development of new opportunities, but really looking at our sites, we don't really need assistance in standing up additional fixed or mobile resources. What we countered with was instead of using federally allocated vaccine at a site that doesn't exist, a more efficient use of the vaccine would be to administer those doses at one of our currently operating locations. And so we provided them with data to show the unfilled capacity at our currently operating sites. We have a current unmet need of about 35,500 doses that we could administer each day if we just had the vaccine. When we look at where we're planning to put future state-operated sites, that unfilled capacity goes to 66,000 doses per day. We also felt that with our healthcare providers and our local partners, pharmacies, and federally qualified healthcare centers, that we have ample capacity for fixed community-based and mobile-based clinics. Just to give everyone an idea, there are still over 300 pharmacies that have been onboarded and willing to administer vaccine, but because of the limited vaccine supply, they have not received any doses. And we've also had multiple community-based providers and significant ones that are trusted by our underserved and hardly reached communities at high risk for COVID-19. They have only been able to receive small amounts of vaccine to provide community-based vaccination clinics. So after a lot of deliberation, we appreciated FEMA's willingness to provide a federally supported vaccination site in our state, but we reiterated our request we just need the additional vaccine. We've got the sites, they are fully staffed, they are efficient. People can get in and out of our sites in 30 minutes. And so what we were asking for was just the additional vaccine so that we can operate our sites at the capacity that we had planned. As I'm sure you're all aware, we have worked with our FEMA partners and have continuously requested additional vaccine to support the unfilled capacity. And at their direction, we have put in multiple requests for that additional vaccine, and every time our request has been denied. So since our sites are sufficiently staffed and resourced, and they've proven to be highly efficient and a nationally recognized model, we still have significant unfilled capacity to administer vaccine, and we'll be looking forward to the increases of vaccine that have been promised to us at the end of March and beginning of April. And then finally, yesterday, we updated our school dashboard to reflect the changes due to Executive Order 2021-04, which encourages schools to utilize the CDC's updated guidelines or guidance for returning to in-person learning. This now is available on our school's webpage and is also still filterable by county. You will see that it just has the two current metrics and will say what transmission category that either the state or that county is in. And with that, I'm happy to take any questions.
Thank you, Dr. Christ. Our first question is from Peter Seymour.
Hi, Peter.
Good afternoon, Dr. Christ. Thank you for your presentation. So, with the vaccinations going away in the daytime at State Farm Stadium, what new sites are becoming available? Is there any other information you could shed on that? And perhaps could people just walk into State Farm Stadium during the daytime hours? Is that an option right now?
So that's a great question. So what we anticipate is that we will still, even overnight, be able to do 8,000 to 9,000 vaccines, even in those hours. What we will do is we will have more appointments per hour, but given the efficiency at State Farm, so it won't reduce capacity significantly. We are working with a couple of groups on a couple of indoor sites that could potentially be an option. I know the Cardinals have been instrumental in helping us identify the potential options that we have. And we're hoping to get those set up in April so that there's very little time that we are only operating an overnight. But even if we do find a site that operates indoors that we can operate, we really want to try and hit that 1 million mark with our Cardinal partners at State Farm Stadium. So that will continue to operate as long as we can so we can hit that goal.
Okay, so it's still things in the works, that's what it sounds like. But is Dexcom, the new Southeast Valley site, is that the one replacing Chandler Gilbert?
I believe that is. I believe that that's the warehouse that is replacing Chandler Gilbert.
Okay, and just a quick reminder why the switch had to be made?
Because so we are looking for indoor locations. We know that come in April and May, the weather is going to be getting too warm for our volunteers and our patients to safely be outside while our patients are in their cars. Not every car has air conditioning. We know that there can be impacts there. And we know that, we operate, if you've been out there, we operate the pod on iPads. And so that technology tends to not work as well when it is out in the heat.
And a last question related to the heat. What happens to the doses even after they've been deeply frozen and now you're bringing them out, I guess, into 90-degree heat? Because we'll probably have that around early April and maybe the hundreds in early May.
Yeah, so the vaccine needs to be stored at a specific temperature. So once you bring it out, I think it needs to be stored between 20 and 70 degrees Celsius. We have coolers. If you've been out to the site, you'll see coolers on that. And they add things to keep that cool so that even in the warmer weather, the vaccine is stored at the appropriate temperature.
So it won't melt once it comes out of the storage. Okay.
No.
So it's really more about personnel that you're protecting, and equipment, and the doses are a little bit more resilient than that.
Yeah. So the doses, once they're reconstituted. So the Pfizer comes in the -80. We can slower thaw that at -20, or they can bring it out to room temperature. And then when they add the diluent, the fluid to make it so that you can inject it into somebody, that is all done at room temperature. And so that's where we need to maintain that. Once it's been brought to that, you've got about 6 hours to use it. And our pharmacies have a pretty stringent criteria for marking it and when it goes out and knowing what the end time is on that.
Sounds good. Thank you very much.
Thank you.
Next is Juan Juarez.
Hi, Juan.
Hi there, thank you for making the time. So I had maybe about 3 questions for you. The first one is something that I'm just curious, and I'm sure maybe some other people in the media are, maybe they don't want to ask it, but when will media essentially be eligible to get the vaccine? A lot of us are still working out there in the field. So are we eligible yet or not time yet?
That is a great question. So under our previous under our previous prioritization model, our media would have been categorized under as an essential worker under 1B. With our current hybrid prioritization model, the media are not included in those 5 or 6 very specific industries. So you'll be eligible once we hit your age bracket, which we anticipate being at 45 and above before April 1st, with the entire Arizona eligible population by the by May 1st.
Okay, just wanted to clear that up. Thank you. So the next question is actually regarding I just wanted to get your reaction on the CDC guidelines for schools. We have the executive order from Governor Ducey. So what do you think about the 3 feet guidance? Do you think this is going to perhaps, ease off or help more Arizonans be a little bit more confident, with schools? And also, could that trickle down to be applied in other areas in our state?
Yes, so we've been reviewing that guidance. The guidance, for those that don't know, basically suggests that in the schools, you can go from 6 feet to 3 feet between desks and keeping that physical distance. We think that that is a great thing for schools. Our schools have done a phenomenal job at implementing those mitigation measures. So masks, physical distancing, cohorting. We have not seen significant transmission within the classroom. And so we think that this is encouraging and will allow our schools to even more comply with the CDC guidance and have children in school learning.
And lastly, regarding the move from the changes in the operation hours, obviously you've been doing a great job in getting so many people throughout, the day. So do you think this is going to perhaps slow down just because you're going to get rid of, in a way, of certain times available during the day? Or do you plan to have already that transition so you don't have the lapse in between getting an indoor facility when you stop doing, during the day hours? So could that limit your capacity to vaccinate more people and reduce the amount daily? Can you touch on that?
Yeah, absolutely. So when we move State Farm to an overnight facility, we shouldn't lose a lot of capacity. We're currently doing 9, 10, 11,000 doses. We've hit 11,000 on a couple of days. And so we shouldn't lose a lot of capacity being able to still do 8 to potentially 10,000 overnight. I think, if Arizonans, the hours, because it will be overnight, may be a little bit more difficult for some Arizonans, but that State Farm without the daytime appointments should only be for a little bit, because we do plan on opening and transitioning to that indoor opportunity, which would allow for those that want those daytime appointments to be able to do that. Surprisingly, as we've seen, we didn't know initially how much demand there would be for overnight appointments, but they fill up when we put them out there. So I think that that's encouraging. But our goal is to find another site with the same or more capacity to be able to offer those daytime appointments. And we're hoping that that won't be more than a week or two for that transition.
Okay, thank you.
You're welcome.
Next is Valerie Cavazos.
Hello.
Hello, Dr. Chris. Thank you for talking with me today. I'm just going to give you some information that we have, and then it ends with a question. So,
Okay.
I have confirmed that FEMA has offered to run federal pods in Pima County for several weeks, adding to the vaccinations. This will be in addition to what's already being allocated. Pima County has already set up or has planned 2 sites, and this would serve Latino communities, underserved Latino communities. Right now, Pima County is waiting for approval from the state, but Pima County is hearing that the state staff is telling them the state is not inclined to approve. So I'm trying to get a status on this, and if it is rejected, why wouldn't the state approve this?
Yeah, absolutely. So that goes back to that the state has extensive unfilled capacity. We are, our sites are leading the nation in our national models. This was a suggestion that was brought up on Friday night, that the FEMA could potentially come in and bring a fixed site, which is the only way they would be able to give additional vaccine to Arizona. That fixed site would have potentially been with a mobile site, but not both sites were planned for Pima County. So I don't know. One of them was planned for potentially Maricopa. As we started getting more information and talking with some of our counterparts, those states with federal sites, including California, have not fared as well. We have been doing a great job at our sites, and they still needed us to be able to staff it, to provide the resources for it, only we did not have the medical oversight or the managerial oversight of these sites. And we had been hearing, some of the issues at some of the federally operated sites around the state. Because we have so much capacity, we would have preferred just to get that vaccine through into our currently existing sites. The University of Arizona still has extensive ability to add vaccination. And so we continue to work with FEMA, but we have opted not to take them up on a vaccination site at this time. And so, with the data showing that we're leading vulnerable communities and across all of our indicators, we felt that Pima County was doing a great job reaching those locations.
Pima County tells me, though, that they want this and they could use this to help in their Latino communities, the underserved Latino communities. And they have 2 sites that are already set up, El Pueblo and Keno, and that would then reach, as opposed to the U of A. That would require some of these people to move over. So if Pima County wants it, then why would the state not want Pima County to have it?
Because it still requires significant state resources and certain guarantees that the state was just not comfortable providing for a site that we didn't think would add a lot of capacity beyond what we had.
So for confirmation, though, you're saying that Pima County, it will not happen in Pima County?
So at this time, the state has declined getting a FEMA federally operated site in the state, yes.
Okay, thank you.
Then we have Mark Phillips.
Hi, Mark.
Hey, good afternoon, Doctor. It's been a while. I had a different question than what the other reporters have been asking. I'm interested in finding out if you're comfortable with the level of testing in Arizona, if it's giving you an accurate picture of the COVID variants, and what are you learning, and is it impacting your treatment strategies?
Yes, so we are comfortable with the level of testing. We have significant testing capacity in Arizona. As we watch, we've still got 20 to 30,000 tests, diagnostic tests being reported in Arizona each day. So we're comfortable with the level of testing. We do have a strategy that randomly selects, or if there are specific criteria, allows for the sequencing of those so that we can identify variants. So we're partnering with TGen, the CDC, ASU, to do this sequencing so that we can identify as we get new variants or ones that have been identified around the world here in Arizona. Right now, it has not changed our strategy, but we continue to monitor because we are highly aware that viruses mutate. Some of those mutations can result in things like the monoclonal antibodies not working as well, potentially vaccines not working as well, which is not the case at this time. But we do continue to monitor because it is a concern.
Can I ask you what have you discovered since you've been looking for this so far, especially, I guess, the UK variant?
Yes.
That seems to be the one that's causing the most consternation.
Right. So we have had several cases identified with the UK variant and the Brazil variant. So here in Arizona, and we continue to monitor and look for that. Again, it hasn't changed the what our current strategy is at this time. We do make sure that we're working with our local county health departments as we identify those cases so that they can work with them, do the contact investigation, isolate and quarantine as necessary. And we're watching what's going on in other states as well.
Thank you.
You're welcome.
Shelby Trahan.
Hi.
Hello. I was wondering if you could talk a little bit more about targeting certain communities throughout the state, and how you're reaching out to all of the Spanish-speaking community to make sure that they're updated on all of the different information that's coming out, especially since we're moving into some of those inside places for vaccination sites.
Yeah, absolutely. So that is one of our priorities is reaching our vulnerable communities. So we've been doing some of that high intensity targeted outreach, which we've been doing Spanish and English town halls We have been working to get our website and the materials updated so that it's all in Spanish. That's always a work in progress because our epidemiologists and our staff are always creating new information. But we are also working to expand some of those efforts into new areas. And then those efforts then also get put, so as we're expanding that 85009 zip code into other zip codes and areas throughout the state, those are targeted and done mostly in Spanish. We do some things in English because we do understand that there's a part of the population that is English speaking, but we try to meet the individuals where they are. Our pod vaccine scheduler has been translated to Spanish, and so individuals can either do that to identify a appointment, or we have a Spanish option in our call center, so that 844-542-8201 is in. You can reach a Spanish operator and talk to them to get scheduled. So we do try to make sure that we are doing that, but we're also reaching out to our Spanish media partners and working with them as much as possible as well.
Okay, Allison Steinbach.
Hi, Dr. Christ. Thanks so much for doing this. So given that the state declined FEMA's offer, which it sounded like would have brought in more doses total, was there concern about turning down those additional doses? And second, why can't FEMA just give that allocation of extra doses to state sites that they would have provided with their sites?
That is a great question. We asked that. They said the only way that vaccine comes into sites into states is associated with sites, because we've been asking for that. Less hesitant to turn down additional doses when we're hearing that they may not stay additional doses, that they may come out of the state's total, like the allocation that we're currently getting. As well as we're hearing that there's supposed to be a significant increase in the vaccinations that are coming in, or the vaccine that's coming into Arizona. So we felt a little bit more confident. It would have taken a week or two to get those sites up and running. It would have required a lot of state resources, but we wouldn't have had a lot of say over how they manage that operation. We even talked to them about partnering with us on one of our existing sites, or one of the sites that we are looking at bringing up as a state-operated site. But then they said that they would have had to have the medical control as well as the managerial oversight of the pods. We run our pods relatively well. We get a lot of really positive feedback, and I don't know that Arizonans having to wait 4 to 5 hours to get through a non-state operated site would have been as acceptable as our current operations. So there were just a lot of things that went into that didn't make us comfortable with accepting those sites. And knowing that more vaccine is coming on the horizon, we did feel comfortable at this time declining on that offer.
Okay, and just one more thing on that,
Yeah.
if possible. Was it clear that those would be additional doses or state doses? You sort of, I feel like, said both, but I'm not totally certain on that.
Yeah, so the initial offer was for federally allocated doses. What we weren't clear is if those stayed federally allocated doses or if they would eventually come out of the state's allocation. And so that made us a little bit nervous, and we couldn't get great answers on that.
Okay, sorry, I actually have one more question and then I am done.
No, you're good.
You mentioned that the state sites have an unmet need of about 35,000 doses if there was more vaccine, and that increases to like 66,000 doses per day with the additional sites. What are those additional sites?
So we're still evaluating bringing on sites in Coconino. We're looking at additional sites here in the Metro Phoenix area, as well as one in like the Northeast Valley. So when we look, and then there are currently operating sites that we do supply Pfizer vaccine for that say that they could go bigger if we were able to give them more vaccine. So when we take into account some of those other sites that we're looking at, that's where we get the 66,000 doses.
Great. Thank you so much.
You're welcome.
And our last question is from Avery.
Hi, Avery. Can't hear
Hi
you.
there. Can
Oh, there
hear
you are.
me?
Yeah, now I can hear you.
Okay, thank you so much for taking my question. It's just kind of going off of the CDC changing the recommendation to children sitting 3 feet apart or staying 3 feet apart in the classroom. What do you have to say to teachers and parents who are still concerned about returning to those classrooms right now?
So what we would recommend is, that's why there's still an option for virtual. We know that there may be families that have somebody who's high risk. We know that there may be teachers that have a high risk condition. And we know that the vaccine is still limited and people may not feel comfortable returning until they get fully vaccinated. What we would encourage is that our data shows that our school classrooms are safe. There is not significant transmission taking place in our classrooms in Arizona. So we would recommend, you choose the model that is the best for you and your family, and that's why those additional models are continued to be offered.
Okay, I think that's the end of our questions. Dr.
Thank you
Christ,
so much.
Oh, thank you.
thank you very much, Dr. Christ, and thank you for joining us this afternoon. Everyone have a great weekend.
Yeah, thank you. Everyone have a very, very nice weekend.